Hey everybody, Tyler McLennan from Dentist On Demand.
Mark Wagner from Dentist On Demand.
And today we're super excited to have with us Dr. Paresh Shah. Dr. Paresh, welcome to the Dentist On Demand podcast.
Thank you for having me. I think it's really cool.
Dr. Shah, can you remind me the name of your practice? You're right in Winnipeg there, right?
Well, it's interesting you say that because I've been, it's been known as Westwood Dental for like over 25 years, but I'm actually just changing the name. And this is the first time I'm actually officially making an announcement. It's going to be called Revive Dental at Westwood. And I just haven't rolled it out on social media and that, but I'm going to next week.
Well, hey, you heard it here first on the Dentist On Demand
podcast. There you
go.
This is like a scoop. It's a major scoop.
We knew this was happening, right? Yeah.
So this is really cool that you joined us today. I mean, we did the, as you saw, we did the 12 days of toothless back in December. It was a ton of fun.
Yeah, that was so cool.
Yeah, and we reached out to you, and obviously you're blowing things up on your own social media. You're quite active. We love what you're doing, by the way.
Thank you.
We're big fans of your social media posts and whatnot. So great work.
I appreciate that.
Yeah,
thanks.
Absolutely. So before we jump into my questions, do you mind if I read a quick bio on you?
Sure. Yeah.
Well, if we must.
Well, I usually, even when I'm lecturing that, I usually tell people, let's just keep it really simple. And then I got a slide that I could just cover things. So, yeah, just if you need to do highlights, you can go ahead. Yeah.
That's right. So Dr. Paresh Shah has been in private practice in Winnipeg, Canada since 1992. Graduated from the University of Manitoba Dental School in 91. Completed the general practice residency at the Health Sciences Center in Winnipeg after graduation in 92. Prior to dentistry, you did a microbiology degree. I'm gonna, like you said, I'm gonna bullet point my way through this. You've served as a clinical mentor in the postgraduate program in aesthetic dentistry at the University of Minnesota from 2001 to 2009. And you're currently, you're not instructing right now. So I know we mentioned that.
Yeah.
Okay.
Not right now.
You're on the editorial board of Teamwork Journal and the Canadian Journal of Restorative Dentistry and Prosthetics. Prosthodontics. And you're the founder and co-director of the Seattle Study Club affiliate in Winnipeg.
Correct.
Wow, that's a mouthful. As you can see, I'm tripping all over myself here. So yeah, that's pretty cool. You've got a long list of sort of credentials. You've been in dentistry a long time. So yeah, I mean, I just want to kind of jump right in and with your blessing, what got you into dentistry?
Well, it was interesting because I was doing, I was ready to start a PhD in physiology. I was actually just finishing up a master's. And my dad, who's a physician, my wife, who's a chartered accountant in corporate finance, they sit me down one day and they just said, you don't look happy doing this. I don't think PhD is the way to go. We don't think that. Why don't you think about dentistry? Right. No word of a lie. And so they actually started filling out an application. So I go to my supervisor, Dr. Friesen, who was an amazing individual. Like he was a physician and researcher, and one of the top 100 that was noted in Canada a number of years ago. But I was talking to him and he's like, oh, I think you'd make a good dentist. I go, what about a doctor? They're like, oh, no, I think you'd be the... Anyway, and that's how I ended up going into dentistry, to be honest with you.
Right. So
it was a nudge. It was a big nudge.
What makes a good dentist? What would you say makes a good dentist?
Oh, man, that's a good question. I've never really been asked that. So
yeah,
this is
I
another first.
All night about that question. That's all.
Another first. I really feel it's not just as a dentist, but for whatever you do in life and whatever career profession you have, I think there has to be an innate passion and drive, and a willingness to self-reflect, a willingness to want to continue to grow and learn, and to be able to connect with the people that you work with, including all your patients. And that's a lot of stuff, but so you really have to be well-rounded, in my opinion. If you don't enjoy it and you don't have the passion, well, like anything else, it's work, it's cumbersome.
Right. Yeah.
Yeah.
And we see that on your social media. You definitely do. It exudes through your social media that you have a passion for dentistry, and listening to some of your speeches too.
Some of your lectures, yeah.
Some of your lectures, it shows, definitely, yeah.
Thank you. Yeah.
Dr. Shaw, can you tell us a little bit about your involvement with the Seattle Study Club?
So, oh man, I'm so biased with them because it's become a family for me.
I bet. Yeah.
But in a really great way. So, for me, comprehensive dentistry, integrated treatment planning and diagnosis is so important.
Mhm.
And they are an amazing network. There are a lot of great, you know, teaching institutions, but this is beyond that. They serve like a university without walls. That's kind of one of the things that they talk about. But the Seattle Study Club Network is a network of, it was founded by a periodontist who's a mentor of mine and a friend, Michael Cohen from Seattle, and it's been around for about 28 years now,
Mhm.
27, 28 years, and it's a
Wow.
group of study clubs globally. Majority of them are in the U.S., but and the whole premise behind the Seattle Study Club is comprehensive interdisciplinary diagnosis and treatment. And
Mhm.
so, you know, I've been fortunate to speak at symposiums and other lectures, and I've been able to do a lot of lectures at a number of Seattle study clubs over the last probably 8 to 10 years.
Mhm.
There's about 280 clubs or so around the world, and so it's been a great inspiration, as well as a resource, as well as a family for the whole thing. So myself and my orthodontist buddy who I went to school with, Tim Dumore, we started our own Seattle Study Club affiliate. We started a study club in Winnipeg over 15 years ago, and we've been part of the Seattle Study Club network, I think, for probably 12 or 13 years.
Okay.
And so what we do is we've got a really great collection of dentists in the city, including specialists. We have about 38 members. We've got about 8. We've got all the specialists except for prosthodontics. We haven't been able to get that yet.
Mhm.
And it's been fantastic. So we do treatment planning sessions. We bring speakers in. Right now we're doing a lot of it virtual. It's been great.
Right. And I recently I changed dentists probably about 5 years ago, and
Yeah.
the experience for me, and this goes into my next question about comprehensive care, is like when I sat in his chair, he really kind of interviewed me and found out, like,
Yeah.
really sort of got the whole picture of my oral care, and he
Right.
kind of educated me on how my oral care on a comprehensive level really sort of has implications, or how it affects my overall health. So
Right.
when I say that, I guess for our viewers that are watching that are patients, what really is comprehensive care?
Well, it's exactly what you're saying. Like, from a dental point of view, um, it's not looking at just fixing a tooth. It's looking at the underlying reason why it may be breaking down, whether it's a restoration or just a natural tooth. Like, why is there decay? Why is there periodontal disease?
Right.
Why does it keep chipping, fracturing, wearing? Like, asking the why, so we can create, we can figure out that problem, just like Simon Sinek, like, what's your why? And
What's your why?
going
Yeah.
into it and going, okay, well, what can we do to get it back into health, and what can we do to help you maintain it?
Mhm.
And so looking at everything, like if you've got wear on a tooth and then you put a filling in, and then the filling breaks, and then you just say, oh, well, let's just do a crown. And then later on, something else chips or breaks, and you're going, well, what's going on? Well, let's put a stronger material in. And maybe
Mhm.
it's because the tooth is out of position and you needed braces to put it in the right spot to give the right amount of room to restore
Mhm.
it. And
Right.
if you're just looking at one single thing, it's no different than, I guess, if you got a leak on a wall
Mhm.
and you just buy some putty, buy a little bit of paint, and cut out that little tiny leak and
Yeah.
just patch it up. And then 6 months later, there's a
Leaking
water
again.
stain around it. It's like, well, let's open it up and figure out what's going on. There's a
Right.
leak from the roof.
Yeah.
So it's the same thing. And then the other part is trying to get, and when I created a new vision, mission, and everything for my practice over the last year and a half, I want my patients to also partner in their care. I want them, just like you, to understand your responsibilities and your innate drive or motivation to want to keep your health.
Right.
So a little bit of both.
And it's all the disciplines of dentistry working together for the greater good, right?
Right, right. So, part of this thing is I have this little pet peeve, like there's, everyone uses him, and especially in medicine, we say, oh, we have a multidisciplinary practice. Well, there's kind of a difference between multidisciplinary and interdisciplinary. I didn't make this up, but it's a mentor of mine, Rick Robley, who's an orthodontist in Arkansas, that wrote a book on this that my orthodontist and I read, like, I don't know, 20 years ago. And well, probably about 18 years ago, we read it. But multidisciplinary dentistry is that we're aware of the different disciplines. Like, we're aware of orthodontics, perio, endodontics, everything. But we'll just kind of send off our stuff. Like, I'm not going to do the ortho and the endo, so I'll just go here, do a root canal on the lower left molar and make the teeth straight. And they'll just do it, but they won't ask, well, what are you doing after? Are you doing bonding, bleaching, veneers? Like, are you placing an implant? They
So
just
what's the
do it.
treatment
And
plan?
right, what's the treatment? So all of a sudden everything comes in, and let's say you got these two little skinny peg laterals, and then you've got normal sized teeth everywhere. And you really wanted to create space to be able to do a veneer on those peg laterals, make them look bigger, make the spaces proportion, but put the tooth in a position that I don't have to take a drill to it. I just can stick a veneer on top of it, no prep. But I don't convey that. They just do it and they close all the spaces. Now the braces are off. They come and see me, and now I got to tell mom that I got to put braces back on.
You gotta back up the boat a little bit, right?
Right. Or there's not enough space to put an implant because the roots are crisscrossed in the bone because they didn't line the roots up. They only lined up the space.
Right.
And I'm not blaming them, because it's just as much the restorative dentist's fault for not talking to you as an orthodontist or as an endodontist or oral surgeon or periodontist to go, hey, let's do this properly. So interdisciplinary is where we're all collaborating and talking, and we're discussing the treatment plan. So that the surgeon will go, okay, listen, you want to do this, but when the orthodontist creates a space, there's no bone here. So I can't promise an implant unless we do a graft. So let's let the patient know that once the roots are lined up properly, we're going to do a bone graft, and then you're going to put the implant in. And where do you want the implant? And what depth? And what kind of crown are you going to put on it? Because we might use a different abutment on the implant. We might use, whatever it is. So we're really talking and communicating and directing one another.
Right. I was just going to say, who spearheads that then? And you spearhead that journey then?
So that's
I think it should be the restorative doc, the prosthodontist or the restorative doc, but deferring to the expertise of the specialist, because that's what I'm saying. Like, if the specialist goes, listen, you want this done here, but it may not look good because it's going to be hard for me to put bone in this area because they've been missing a tooth for like 20 years. So here are your other compromises. Well, let's talk to the lab, because maybe the lab has to create bone artificially with some porcelain or acrylic. So we got to plan that so that there aren't surprises for the patient.
And it's based on what the patient wants. If you're having that conversation at the start of the process and saying, okay, Tyler, here you are sitting in my chair. What is it you want? What does the end result look like for you? So that all along the way, you're mapping it for the patient to say, we're following this plan in accordance with what you want as the patient. Are we still on the right path?
Right. And you know what? Sometimes it involves so much work that they'll say, look, I either can't afford it or I don't want to take that time. That's fine. And then the next question from the patient should be, well, if I don't do the ideal, what are my limitations, or what are the compromises I have to accept? And I think it's important for us as clinicians to be able to think several steps ahead and be able to give them the risks of maybe not accepting ideal treatment, because not everyone's going to accept ideal treatment.
Yeah, I mean, there's other factors that come into the equation, as we know. I mean, it's not an ideal setting every time, but we try to get there as much as we can, right?
Yeah.
And I like that process. And for me, when I switched dentists to someone who's more your style in the way they practiced, for me it was amazing. But then, it was a long conversation with my wife for her to move over to this new dentist, right? Because, you know, my wife doesn't like change very much, right? She's like, hey, I like my dentist. What's going on here, right? And, you know, it's always hard. No one likes to leave their dentist, especially if they have a good relationship with them. But for me, because I work in the dental industry, seeing the comprehensive side of things, I was like, wow, this is a whole different world for me. I like what I'm seeing here. So when I convinced her to come over and talk to my dentist now, she was like, you know what? He felt around my jaw. He looked at more than just my mouth. He looked at all these different areas and, you know, asking if I was having headaches and, you know, if I'm having TMJ issues and all this other stuff. And she's like, I was getting a lot of questions that I never had anyone asked me these questions before. So it really appealed to her.
Right. No, I agree with you on that. It's one of those things where it takes time. It takes time to build that rapport and that relationship.
And so you do quite a bit of cosmetic dentistry at your practice?
Yeah.
Okay.
I really enjoy it. Yeah.
The reason I ask is that I've made a note. Aesthetic dentistry. Sorry, do we have a visitor?
We had a guest.
We had a guest. I think there was a dog running around somewhere. Are they good? Do they need us?
Oh no, we're good.
Okay, we're good.
Yeah.
With regards to cosmetic dentistry, the question I had, and you can tell me if I'm out in left field here, but aesthetic dentistry, is it more than just a pretty smile?
Well,
it's kind of an obscure question, but I think there's more to the equation, I guess, right?
Yeah, I mean, ultimately, I think when you're thinking about aesthetics, it's probably that's a deep question. Wow. well, no, but I guess everyone will perceive aesthetics in a different way. So I kind of break it up into aesthetics and function and how they both pair together.
Okay.
And
yeah.
so
that's kind of what I was going with it, yeah.
Right. And so if I'm talking to a patient about, you know, the different, like, you know, what are they looking, is aesthetics important or is function more important, or are they both important? Mm-hmm. So I look at aesthetics as everything from the face inward, like not just looking at it just with the lips or the lips retracted, just looking at the whole face. And when you're, you know, walking into a room or you're walking into a washroom and you're looking at a mirror or you're at conversation distance, like, are you happy with what others are seeing or what you're seeing in the mirror? Mm-hmm. That I kind of look at as aesthetics, but from the whole face inward. Then from a functional point of view, it's another thing, like, you know, like, can you chew properly? You know, are the restorations going to last? All that kind of stuff. So
yeah, are you having premature wearing and yeah.
So I don't know if that answered the question, but I think from aesthetics, it is more appearance related.
Well, yeah, and the reason I ask that, because again, you know, as a patient, I'm like, you know, because most people don't know that conversation. They don't know that exists, right? So it's like, okay, they're making my teeth look nicer. And then 6 months down the line, they realize that they're wearing prematurely, or there's something happening in their mouth.
They got headaches,
or whatever.
Yeah.
So it's good to know that there's dentists practicing, such as yourself, that are like, okay, well, I mean, to some people it might be obvious, but I think to the patient base, for me as a patient, it's nice for me to know that my dentist is taking function into consideration almost as much as they're taking the aesthetics into consideration.
Right, and it is important. You know, a good analogy or example is, you know, back in the days, like, you know, 15 years ago, and we had Extreme Makeover, right? And all of those shows. You know, people would come in and they're going like, hey, you know, I just noticed there, and they had the whole new smile in, you know, 2 episodes. And, but they're not necessarily realizing some of them went through, you know, even if it's not long-term, but short-term orthodontics, or they went through orthodontic surgery, or they had to do gum surgery and implants and other things like that. So, and I don't think everyone realizes sometimes if the teeth are really crooked and overlapped and you're doing it with crowns and veneers, you're cutting away healthy tooth structure. Right. So all of those kind of things. Yeah. So to your point, they have to understand, well, what are the limitations? What are the compromises? And, you know, if you do some of the compromises, are they going to last? Are you going to end up with a bunch of root canals? So yeah, it's a combination of both things. And I think it's important, like I said, we have to be ahead of the patient by several steps to be able to answer those questions. And also warn them about some of the little nuances that you go along the way. Yeah.
You're running into a landmine here in the future.
I know.
Yeah.
So, Dr. Shah, I come from years and years of CAD/CAM. I have some CAD/CAM background.
Yeah.
Not
Oh,
very.
I love that stuff.
Yeah.
What's your favorite gadget in practice?
That's a good question, actually.
Our scanner. Absolutely.
Definitely
Yeah,
your
our
scanner,
intraoral
right?
scanner. Yeah.
Using the iTero?
I got iTero and CareStream.
Okay.
Okay, so what I want to do is I want to contextualize this for our audience. Is that so?
Yeah.
I'll tell a quick story. So I was at a dinner party one night. This is about 3 or 4 years ago, and one of my friends comes to me and says, "Hey, Tyler, you work for this dental supply company. You guys sell technology, right?" And I said, "Yeah." He says, I went to this dentist, and they I needed a crown, so instead of putting the goo in my mouth, he says, I couldn't believe it. The dentist took this machine and he waved this wand in my mouth, and all of a sudden I saw my teeth up on the screen. He says, "Why doesn't every dentist have this?"
I know.
He was completely dumbfounded. He's like, "You sell these, right?" I said, "Yeah, I sell them." I said, "It's part of what I do." And he says, it befuddles me that every dentist doesn't have one of these in their office." So for him, he was like, the experience of having an intraoral scan done, which is the digital scan, versus an impression done. And I understand there's still cases where you still need impression material, but that experience for him was so, like, he didn't mind. He wanted to go back to the dentist and have it done again. He just thought it was so cool. But for you, like, what has dentistry done? Digital dentistry for you, is it dramatically changed dentistry for you? And you've lived through the change, so.
Yeah, it has. It sparked a passion. I just feel that digital dentistry and an intraoral scanner is kind of an entry point to a lot more within your practice, because you're all of a sudden opening yourself to different workflows that are, in my opinion, more challenging with an analog process. Because if you're like, like even with the digital smile design process, you can still do it manually. You can still do it with, plaster casts and all that stuff. But, how powerful is it where you've got, now you can take a 3D scan of a face on an app like the Ivoclar app, the Ivosmile app, or even like Bellis 3D, and you've got a 3D scan, import it into your planning software, have an STL file of an impression of the upper and lower, design a smile right within the face, rather than looking at a plaster model in my hand, a photograph here, and some wax and a burner, and you're trying to make it look like that, or you're going into the second level of 2D where you've got a PowerPoint and you're doing it. Now you got it in 3D. So what I do with my specialists now is we plan it all digitally. So if we've got a CBCT, like a cone beam, we've got STL files, we've got a digital smile restorative design, we've got photographs, and it's all integrated. And now we're on Zoom with the oral surgeon, with the endodontist, with the orthodontist, with the periodontist, and myself, and we're planning a case with real data.
That's pretty amazing.
Real data.
Stuff, yeah.
Real data, yeah. That you've all captured, you've all put it into the same system, right?
So I'm just going big picture, but it opens up so many things in terms of communicating with the patient, showing them what is possible, and planning the cases and treatment planning the cases. Now, when we roll it all back, just for simplicity, if you take a plaster impression, you just take a regular impression and you send it off to the lab. It doesn't mean it doesn't work, because it worked for years. But look at all the variables you have. You've got temperature, you've got water powder ratio, you've got the mixture of the materials, you've got dimensional stability, you've got some kid in the lab that might have been up all night partying, and now they're not even mixing the water powder.
They might be still partying at the lab, actually.
Yeah, they might
like
still be
all
there.
of those things, like the saw cuts on the die, and are they trimming the die properly?
Right.
Now you just give it digitally, and you got to give a good impression, and you got to have a lab that understands what they're doing, and otherwise the data is accurate.
Right. Tell us about the Smile Test Drive.
So, you know what? Like, it's one of those things where, how powerful is it? Like, I've been doing stuff like that for years. So one of my mentors who passed away a few years ago, Paul Belvedere, he taught me just to do a mock-up in the mouth.
Mhm.
And it was like over 20 years ago. And where you're like, how much, like, looking at a photograph is one thing of yourself or even a video, but actually feeling it in the mouth and walking to a mirror and looking at what potentially the treatment could look like is so impactful, because you've got
Hugely. Yeah.
you got your lips, you got your tongue, you got mobility, you got facial expression. So, for small cases, 3, 4, 5, 2, 3, 4 teeth, I'll just retract the lips with some cotton rolls, take some composite, and I'll just quickly put it on the teeth, shape it, polish it quickly.
Mhm.
3 to 4 teeth can take me like 5 to 7 minutes, something like that. And all of a sudden I can walk you to a mirror on the wall, not a
That's
hand mirror,
super
because
cool.
as soon as you look at the hand mirror, go, what is this stuff?
Yeah.
Walk a mirror on the wall, conversation distance, and just get them to look.
Mhm.
Is this what you're looking for? And if it is, that'll impact them right away. If it's something larger, now what I do is I'll take a photograph, I'll take an STL file, I'll get my lab to design a smile digitally,
Yeah.
and then we'll print a model, and I'll create a little putty that I can put some temporary material up, put it in the mouth, and within a couple of minutes, they've got a test drive as well.
Is that
Mhm.
So I
right? So
do
you
it
can do
both
it that
ways.
fast.
Well,
Yeah.
you can, like, so I can do it in the mouth directly with some composite,
Mhm.
but if I'm doing it, and for our American friends, composite,
Mhm.
Right.
and
Of course.
but if it's something more complicated, I'll get the lab to do the design. I have a model printer in my office, so they'll do a design. They'll send me the STL file. I'll print it out. I'll make a putty matrix. So sometimes if I plan it, let's say you're the lab, and I said, listen, I got a patient coming back in 3 days. Can you just quickly do a design for me? Charge me whatever it is for doing the digital wax up. Send me the file. I'll get it back. I'll print it out. I'll make a putty. I'll put the material on and bring the patient back, and I'll do the test drive. If they like it, that is my prep guide, and I can just continue on and do the bonding or veneers.
That's a great case for in-office printing, I guess, right?
Absolutely. It works. It's
yeah.
fantastic to do that for diagnostic models, for creating bite splints, surgical guides. Yeah,
Do
just
you mind if I ask what do you use?
I've got 2 of them. I've got the Form 2, but it's the original version, so it's
Yeah.
updated substantially. So I don't have the newest one, and I've got the newest Sprint Ray, which I love. It's just fantastic.
I heard it's pretty quick.
Yeah, it is
Yeah.
fairly quick.
Yeah.
It's good, and it's a good price point, both of them, for a solo practice.
Yeah, for sure.
Yeah.
I think 3D printing is the next evolutionary.
It's interesting because there's that
practice.
debate. I mean, we could even ask Dr. Shaw. I mean, is it the future for you? Do you see milling as the future or printing as the future?
Well, I think there's value in both an additive and a subtractive
Yeah.
way of doing things. So I think with milling, I mean, it'll depend on what kind with printing, what kind of materials we're going to be able to use that will be in the mouth for a long time. We still, as far as I know right now, we're still getting, some of the longer standing ceramics and everything. It's better still milled. I saw a model printer at the IDS meeting last year when it was, in 2019 in Germany, and they printed a zirconia crown, but the printer was like, I don't know, like $400,000. Like, it's not practical. So,
and by the time you use it,
you got to do 10 crowns a day.
You'll never get your ROI out of that machine.
Yeah. So, but I think we are starting to get printers that are going to be able to print provisionals and long-term provisionals and things like that. So to do test drives, and you can print out occlusal guards and things like that. And so I think you're going to have both. But because of the price points of mills, I think we're going to still find for the near future. In the average practice, if they're going to go do anything, it'll probably be a printer over a mill.
Yeah,
that's my feeling, just from a cost point of view.
Well, I think you hit the nail on the head with the materials part of the equation, because I think it's only now that we're starting to see some denture resins come onto the market that are safer in the mouth. So I think you're totally right. That the machines can do it, can the materials do it?
Right.
So,
right. Yeah.
My next question, I mean, I think we've already answered this, but I mean, I wrote traditional impressions versus IO scanner. So I mean, I think we're all
So
on the same page on that
We
one.
might have covered.
Yeah, I'm so partial to the other, like to the digital one. I mean, the thing is, it's still you know, the axiom, you know, garbage in, garbage out. Like, you still got to have tissue isolation, tissue displacement, and, you know, capturing. It's a camera, so if you can pick anything up, and the beauty of it is, when, as you know, when you capture the image, there's multiple small images in there. So when the lab's looking at it on a big 30, 50, 60-inch screen, it's hard to miss the work and the margins, because all of a sudden there's so many frames and you're looking at the margin all over the place rather than looking at it through loops. So it's accurate.
Oh yeah,
But you have to, yeah, you just have to get that detailed in there.
And did you
And
find?
that's not,
Sorry, go ahead. Oh,
no, it's interesting because a lot of people are still, oh, it still works, it still works. But here's the one thing that I think a lot of dentists are missing is the majority of the dentistry that's being prescribed in North America right now are ceramics, right? We have data on from big labs like Glidewell, and in Canada, Orem is a huge lab, and you know, Frontier and all that. When you ask them for data, the majority of their single units are ceramic. They're not metal. And
Right.
why? Because that's what the demand is by not only dentists, by the public. But the other key part of it is that people forget or don't want to necessarily acknowledge, they are all fabricated by CAD/CAM.
Yeah.
Except for feldspathic restorations that are stacked. So if you give an analog data in there, it has to be converted to digital.
Yeah.
And there's always, doesn't mean it's not going to be accurate. There's a tolerance there. But if you give digital in to a digital system, it's going to be the most accurate.
Yeah.
We know that from science and data.
Yeah.
So why not give them digital information? Because, you know, I think digital got a bad rap a number of years ago, you know, when we first had CEREC and everything, which has been around for like 25 or 30 something years now.
Yeah,
I think
that's
it's
to
like
lead the
34
charge.
years,
Yeah.
34 years or 35 years. So they're, oh, the crowns don't fit well, they're loose. Well, why do they fit there? First of all, your preps are metal-based preps for gold.
Right.
Secondly, it's a round burr that's prepping. So you got it. So of course it's going to not fit like that. Doesn't mean it's not accurate. It's just the burr is a minimum size.
Right.
So you got to change your preps. Because if you're doing a gold prep and now you're asking for an Emax crown, it's not going to fit like a glove like our gold restorations.
Right.
There's going to be room because it's a burr that's milling it. So change your prep.
That's a nuance of dentistry I didn't know. That I didn't know that there was that big of a difference between metal and ceramics when you're
when we did gold back in the day, we would cast to it. So it would just be, you know, we wanted that fit to be really snug. And if there was a little opening, you can take the gold with some loops and you can burnish it over, because gold is malleable and close up the margin, but it had to fit like that. But we can't use a gold prep now to do a zirconia or a Emax crown right now, because you can't mill it down to like 0.1 millimeter.
You could drive a monster truck over those zirconia crowns and they won't budge, right? They're such a hard material.
What are you seeing predominantly zirconia these days? What are you seeing?
It all depends. Like, you know what, I'm doing zirconia and Emax, a lot of Emax. I like bonding my restorations, and now I'm starting to, you know, you can bond zirconia in different ways with a primer and with using air abrasion and so forth. So there are ways to do that, but I'm still using a fair amount of Emax. But majority of my restorations are ceramic though.
Ceramic, right?
Yeah.
Now, because you are a cosmetic, you do a ton of different procedures in your practice. What are your thoughts on teledentistry? Total left turn here.
I've been doing some of that, you know, before COVID hit, and you know, I think it's great. I think just the ability to connect with the patient and have a discussion about what you know, what their concerns are, what their wishes are. Um, you know, it's nice to be able to give them the opportunity to have a chat.
Mhm.
Can I do a complete diagnosis? No, but what I'll do is, you know, if they're willing to send me a full face picture with a smile and maybe a little selfie of
Mhm.
just what it looks like close up, we can at least start a conversation. What do you like about your smile? What do you not? What are your concerns? And then at least talk a little bit about some of the things that we might look at when they come in.
Yeah, and you know,
So,
it's nice because you can start small, right? I mean, we've already talked about comprehensive dentistry, starting the conversation, finding out, like
right,
just like what you say, what do you like about your smile? Is there anything that you'd like to improve?
right,
How's function? Are you getting headaches? Whatever those questions are, just like you
correct.
say, just to start building rapport, getting to know your patient. And I think that it will go both ways. You know, it's not just you building rapport with the patient, but it's the patient building rapport with you to say, you know,
Correct.
I think I can communicate on a really sort of shorthand level with this clinician. I really like this person. I think I'm gonna go deeper with them. You
Right.
know.
No. Yeah, absolutely. So I'm starting to do more right now because some people don't want to come in right away, or if I need to see them a second time just to have a conversation about whether it's fees or, you know, just follow up on some of the treatment, I give them
Mhm.
the option. Now we're just put it directly in our schedule. And
I see that now. I see that like with follow up for Invisalign or for I should just say ortho in general.
yeah,
That some of my clients have told me that hey, you know what, Tyler? Some of my patients, instead of coming in to do a follow up on their orthodontics, they want to talk to me over a Zoom call or over teledentistry, and they're cool with that. You know, they have the option to
yeah,
come in or do it over teledentistry. So, are you finding the
yeah.
same thing?
Yeah, no, absolutely. We're getting some people, and we're just offering it. Hey, if you want to have a follow up consult, we can just talk first here. And sometimes it's just okay. Let's recap the treatment plan, and can we just go over the fees again and treatment sequence and things like that.
Yeah.
Uh, so it just makes it a little easier for the patient. And so we're just trying to. I'm trying to get my team to start thinking differently and go, look, at least offer them that. I don't mind. And, you know,
Mhm.
honestly, if it takes me 20 or 30 minutes, like it doesn't necessarily have to be a fee attached to it. Just let's do it if it allows the patient, give them the information and they actually convert and book the appointment.
Yeah.
Oh, that's what
So
it's all about. Yeah.
And I
yeah,
think half the battle is just them getting to know you, to know who the dentist is. I mean,
correct.
before if I'm to switch to a dentist to a new dentist, or if I've moved to Winnipeg, the opportunity to meet you online for 10, 15 minutes, I mean, I would want that.
And you need winter tires too.
I would
Yeah,
need winter tires.
yeah,
Just
we
making a
would.
joke about your
Yeah.
climate over there,
I got
Dr.
winter
Well,
Shah.
not
tires.
right now. It seems you said the weather's all right.
What
So
temperature is it there right now anyway?
I know. That's why I said
-7.
I do have winter tires. It
Um,
helps.
Are you showing visuals in your consults, on your teledentistry consults?
Yeah, for sure. Yeah,
Yeah.
absolutely. I can do that. I can share screen if we're doing it on Zoom or, um, you know,
you
one
do
of
it
those
before and after?
platforms. Yeah, if someone's asking for that, I'll show that.
Mhm.
Absolutely. Yeah, I'm comfortable with that.
Do you have new patients coming to you, coming to you because you offer that service?
Um, I'm not sure. I think it's more related to, hey, just the services that we offer, but I
Mhm.
don't think I've done as good a job of just marketing the fact that we're, you know, doing these smile test drives and stuff. I think I need to do a better job of that.
Got
So
you. Yeah.
yeah,
You're too busy. You're doing dentistry.
I
So
don't know. You know, there's just so many things going on, and yeah, I guess I just need to kind of narrow that focus, and that's what I'm working on right now.
Awesome. That's great.
Yeah,
uh, I mean, as we know, it's the beginning of 2021 right now, and we're probably going to wrap up here in a minute or so. So thank you again
no worries.
for being on this
Yeah.
with us for so long.
Oh, I
Um,
appreciate that very much. I love what you're doing.
yeah, it's a ton of fun. I mean, like I said, we get to meet some great people along the way. It's been
Yeah,
a ton of fun talking to you.
And you talked about your passions, and we're
yeah,
living our passions right now. So that's what it's all
yeah.
about.
That's awesome.
Um, but before we let you go, I just curious, like 2020, can you sum it
Yeah.
up? Has it had a big impact on your practice? How has it been for you guys?
Um, truthfully, it's you know, you know, forgiving the sadness that's out there and people getting sick and
Yeah.
passing away and all that stuff. It's been it's been a it's been a good year. It's been a
Good.
tough year. It's been an emotional year, but it's been good because it gave me an opportunity to reassess, self-reflect, and pivot. And I've made significant changes in how I'm approaching our practice. And I'm building a new practice right now that I'm hoping will be ready in 2 months to move into,
Congratulations.
which is another first, announced right here.
A new practice. Do you have a name for it yet, Dr. Shah?
It's going to be called, it's with the new
Same name?
branding, it'll be called Revive Dental at Westwood.
So
And,
second location for Revive at Dentistry.
No, it's going to be, we're just moving. It's only a few blocks away.
Oh,
and,
I see.
So I'm expanding and doing that. So what we're, but what it allowed me to do is think about a number of things. How do I want to practice for the next 8 to 10 years that I want to practice? What procedures I want to do, and who I want in terms of team. So I made a lot of changes, and I have a very new team. And there were some people that were not brought back.
Understandably, yeah.
Because I want the right team to work with moving forward.
Yeah.
So I have a lot of changes. Sense. Yeah. And that basically, so was it good? Yeah. And is it stressful too? Sure. Because right now with the lockdowns that have happened in Manitoba, just like in other provinces, we've had less hygiene patients coming in, which means a little less work, like regular hours for some of the staff, which has been a challenge over the last 2 months, but everyone's been really accommodating in that, okay, well, let's take turns and we still want to stay and work with you. But boy, that was long-winded. Yes, it was it's been a good year because I refocused how I want to practice. I set new goals, new vision, and I've got a new team. And so because I didn't sit back and go, I did for about 4 weeks. I had a pity party and felt sorry and oh my God. And then
we all did.
Right. And then it's going to be, no, I'm going to redesign, reshape, take control of my destiny. And that's what I'm doing.
Wonderful. I love that.
Yeah.
And it's interesting because along those same lines, there's a streamlining element to 2020 that, I've done personally, right? So I've got my business, we have Dentist on Demand, we've streamlined Dentist on Demand. Obviously, we're a newer sort of company, we're a newer platform, but the things that we were doing 6 months ago, or even longer, I guess a year ago now, we do things completely differently. Here, we spend a lot more time here now talking to great clinicians like yourself. Whereas before we were kind of like, you know what, we're okay to just kind of ride this out for a while. So there became almost like an urgency behind Dentist on Demand to say, you know what, we need to have a lot more guests on. We need to be talking dentistry 24/7. We need to jump into this with both feet. So for us, I'm sure, Mark, you probably agree. Yeah. We're really in this as well to turn over rocks and find some great people out there who can tell the story of dentistry and help improve access to oral care, which you're doing. We're trying to do, and it's really, I'm looking at the positives of 2020 as well. So
I think you always you always have to find those silver linings. You always have to keep your head up. You can, it's okay to have your pity party, but it's more of I think a pity party is more of a reflection time. Yep. It's not necessarily a bad thing. It's good to kind of be in that spot and think about where you're at and then rise up, So.
For sure. Yeah,
Shah, it has been so amazing having you on today.
Whoa.
Sorry.
I got a question. How long could you hold a plank?
So I did that one. What did I do? I think it was 2 minutes. And
2-minute plank. Oh man, I die after about 40 seconds.
Yeah, I managed to get the 2 minutes in. It was really hard, but I managed to. Yeah, and then the limiting factor was on the floor in the office, so it was a little hard. I had a mat, I might be able to do more, but 2's kind of all right.
I just hear a bunch of excuses. You gotta
I know.
Tough it out.
I managed to do the 2 minutes, so
well, that's good.
I have I go to a small gym here locally, and so my guy he'll train me a little bit here and there, and he'll get me to do the plank at the end of a workout, and he'll say we're doing a minute, and I just, as soon as he says a minute, I'm like, a minute doesn't seem long, but it does when you're planking.
Oh, no, absolutely. I got a virtual workout later this afternoon because obviously they haven't been able to come over. So, and it's funny because, you know, in the basement, everything's set up but he can still see everything. If I'm not doing something, oh, I don't think you got your leg this way, or are you pulling that weight up properly? It's like, oh man, can you see that?
Get off me, buddy.
Sounds like a pro.
Yeah.
Yeah. Yeah.
And big Jets game winner last night.
Yeah, Jets had a big game. Are you a hockey fan?
Man.
Yeah.
Oh, huge. I wish, you know, my buddy and I have season tickets, but obviously not this year. So, and can't wait for the Jets and the Canucks to play and start building a rivalry.
It's always a spirited affair.
It's a purely Canadian setup, isn't it? There's no.
I know. It's awesome.
South. It's pretty awesome.
Yeah. We call them the Calgary Canucks now because half of our team went to Calgary this year.
Oh man, you know what? I'm just picturing us by the time we get into the playoffs, the Canadian division. Everyone should, you know how when the players they're wearing all their stuff when they're walking into the arena and they got all these clothes. I think by the playoffs we should be having Canadian lumberjack jackets, a little bit of back bacon and a beer, and that's what they should
and
walk.
Beards
right?
too.
And the big
beards.
playoff beard. I think that's what all the 7 Canadian teams should be gearing towards as we're getting into the playoffs.
North of the wall.
I love it because we are celebrating what it means to be Canadian. We got bacon, we got lumberjacks, we got it all.
I know.
Maple syrup.
Just have,
come on. Yeah.
Forget the cell phone in their hand, like a big hunk of Canadian back bacon and
I'm gonna have a beaver. I'm gonna have a beaver on a leash. On a leash.
Right.
And the water bottles we bought water bottles of maple syrup, right?
Maple syrup and Crown Royal.
Maple syrup, Crown Royal, and a Molson Canadian.
Yeah, there you go.
Doesn't get much more Canadian than that.
Yeah.
I know.
Dr. Shah, it's been a real pleasure having you on.
Awesome. Well, hey, thanks both of you, Marc, Tyler. It's great. I love what you guys are doing. Anything I can do to help promote you guys, and I love the fact that you're Canadian, but you're also looking outwards, and that's great.
Looking out for our Canadian dentists. So enjoy your virtual workout today, and wish you all the best. And we're gonna have you on again.
Yeah, let's do this again.
Awesome. Love to do that. Thanks, guys. Have a great day. Okay.
Yeah, you too.
All right.
Happy Friday.
Take care. You too. Bye.